Hi, my name is Janine Paulus. I'm the aesthetic nurse at Chicago Aesthetic Surgery Center at Neoderma Med Spa located outside of Chicago's O'Hare Airport. The purpose of this video is to help Dr. Sherba's post-surgical patients take care of themselves after surgery when they have drains. Typically patients after a mommy makeover, a tummy tuck, a neck lift may go home with a drain. And we will teach you in the clinic before you leave and as well as at home through this video how to take care of the drain, how to drain it, how to record these numbers and bring them to the clinic for us to review. Specifically, we're talking about the Jackson-Pratt drain. This is a tube that Dr. Sherba will put in at the end of surgery. Looks kind of like this. It's a flat drain. Not necessarily this long. Dr. Sherba will secure it in place with a stitch about here. Now this much of a tube connected to a bulb. This is called the Jackson-Pratt bulb. It'll collect any excess fluid that may collect in the abdomen or in the neck after surgery. This typically only stays in a few days, but it's important that you take care of it properly, and it's quite easy. So anywhere from 3 to 4 times a day, every 6 to 8 hours, depending on your procedure, and we'll give you specific instructions for you and the procedure that you've had, and we will tell you how many times to drain it and how to take care of it. So what you'll do is take the tube, you're going to kink it like this, in your left hand if you're right-handed. The bulb, which is closed, safety pin to an article of clothing, will be empty. So with the drain tube kinked about 12 to 20 inches off the bulb, you're going to open up the drain, open up the bulb, take the little measuring cup that we give you, just squeeze the contents. You have, you'll know exactly how much is in there. The drain is now empty. You're going to squeeze all the air out like this and replace the cap and pin it back to your clothes. If that's the case and you think that it might be blocking the tube, what I'm going to have you do is, holding it securely in your left hand with the tubing kinked, I want you to hold it tightly. You're going to milk the tubing like this. Take it and just squeeze it, and squeeze out any material that may be stuck in the tubing. It'll be collected in the bulb. I have a patient that's going to have this next week. So we're going to demonstrate, live demonstration. The patient will herself empty the drain, so it's a little bit of practice ahead of time. So I want you to hold the tube and kink it. And take the tube. Squeeze the air out. Cap the bulb. And this form, this is the Jackson-Pratt drain log. It has a place for the date, the time, and the volume of fluid that is squeezed out from the bulb with each drainage. And I want you to record the day and the time and the volume. When you reach a certain volume in a 24-hour period, Dr. Sherba will pull the drain. So that's either, depending on the procedure, it may be anywhere less than 10 cc's in the 24-hour period. And we know that because you're going to fill this out every time you drain your bulb. You record, document the amount of fluid that you've removed, and bring this with you to your post-op visit. Typically the drainage is anywhere from clear to pink or red tinge. There may be some clotted material in it. That's all perfectly normal. We'll go over what's not normal with you during your office visit. Thank you so much for entrusting us with your care. And if you have any questions, please feel free to call our office. We're here to help you. Thank you.